So welcome everybody to the first, if I think this is right, to the first annual bank robbers meeting. Because looking at you guys, that's what it looks like. All right, so welcome, and I'm so glad that everybody's coming to listen about the school and about what makes it so different, because this is unlike any other kind of bodywork school around, anywhere. What it puts together is just a paradigm shift in thinking and in ability to work on things that are really, people truly have going on with them, and the ability to really take in and make a shift in the way you view things. So it's a very big, very, very different kind of ideas. So can we pause for 1 second? Can we pause? No, I'm ready. So what is it that actually makes my institute so different from anybody else's? Is that, here's the deal, is that when you're trying to help somebody actually get through stuff, because, can I ask you to wear a mask though? That'd be great. Is that the deal is that when you have people coming to see you, or if you're thinking about a job change, or you're thinking about doing body work, the thing about body work is that, I'll give you the example, is that when I first started 34 years ago in school, and they taught you that massage could heal anything. And then I went off and I did something called neuromuscular massage therapy, and that could heal anything. And that's just not the truth, because if I could do that, then everything's a nail and I'm a hammer and I'm just going there. But one of the big things about this school is that we're looking for what is the core reason or reasons of why somebody has some symptoms. Because we are so symptom driven in most of our whole medical field. So if I have this symptom, if I have a headache, then what's happening is that I'm always looking at how am I going to manage, how am I going to help reduce the symptoms of the headache. Whereas in Ankrum Institute, what we're trying to do is where's the headache coming from? Well, one of the biggest places that a headache actually originates from is your liver. So here's one of the deals is that if I'm only looking up here for your headache and I'm not looking at a greater view, then most of the time that I'm not helping you get through something. And that is where I've actually evolved to, is how can we find the places where something originates from? So let me say this, is that our body has many systems, okay? Like you have the system of the circulatory system. So there's lots of systems in the body. So how do I know which one your symptom is coming from? How do I know, or how can I begin to view on a bigger scale, what is it possible, where is it that it's going to be originating from, right? So let's do it this way. I'll do it in a second up here, but also is, for our standpoint, what are the major systems that we're going to be looking at in order to look for where would the cause of your symptoms come from? So we have here, especially in our world, the musculoskeletal system. I'll just write it like this. We have the musculoskeletal system, which is 99.9% of the time where people are looking for the symptoms. So because that's where I have my pain. Because most of your pain shows up in your muscular system, right? So most of my pain shows up in my muscles. But unless I've had a direct injury into my muscular system, then that's not my originating system. Boy, I keep putting this down. This is very like me. You should have a table here. The table right here. The table's not there. So what's happening is that we have a musculoskeletal system. And in that system, there's some common places where I'm going to have pain. People have a tendency to have pain in their neck and have pain in the low back area. Now, why? Why are those the two most common places, right? So those are the kinds of things we have to look at is why is my neck and my low back my two most vulnerable places on my body for me to feel pain? So at the end, in this school, you begin to learn and understand like what drives those kinds of things. Your neck, look at this, my low back here and my neck here, don't those look like the only two places that don't have more of a bony support system? So I've got my head, which is fairly solid. I've got my neck sitting out there alone. I've got my vertebrae here that actually go with my rib cage that help keep it more stable. I've got my lumbar back, who much like my neck, is sitting out there all by itself again. And then I have a more full pelvis, don't I? I have a more full pelvis. So these two areas of my body adapt when something else is going on somewhere else. So that's why there's always neck pain and low back pain. I talk in always in absolutes, so take that and subtract a few, okay? So here's the deal, is that these will adapt for something else going on somewhere else. They adapt. So I get pain there because they adapt. And where it adapts the most is here, in my neck. And in my neck, I have 7 vertebrae. And out of all those 7 vertebrae, who's the most adaptable? My first 2. People have made big bucks, actually, as a practice of working with just those 2 vertebrae. And they adapt the most out of any other place in your spine when there's something going on in your foot, when there's something going on like you sprained an ankle. So all of that adapts. So this is why you really want to start to understand actually how does the body actually work. There's a language, there's a way in which it's expressing itself. So we have the musculoskeletal system, and what I always say about it is it's the map of the symptoms. So this is going to be my map that's going to tell me, like, maybe what's wrong. So we use the example of a headache and your liver, okay? So here, left shoulder, right shoulder, right? So somebody comes in to me and they say, I always have right neck and shoulder pain. And unless there's somebody who's working where they're doing something like this all the time, then I'm looking at, well, what would give me always on the right side, right shoulder, right neck pain? Well, the common factor that does that, actually, again, I'm just using this example, is your liver. When your liver is congested, which, hello, I'm looking at a sea of people, I'm looking at a sea of congested livers, okay? So when your liver is more congested and has more trouble, there's lots of symptoms that come out of liver. Higher allergies, sensitivity to your eyes, pain in your right neck and shoulder. It actually pulls your right hip out of line, makes a longer leg on that side. So there's all these things that you learn about the body and the way the body actually functions when you come to school like that. So this is one system. Then we have the fascia system. Does everybody know what fascia is? Yes, yes, yes. Fascia is that connective tissue that's all over the body. And actually I'm going to do my next Facebook Live, which
November 11th.
November 11th at 5 o'clock on Wednesday is going to be on fascia. Because one of the things I've learned in, because I started off a muscle person 34 years ago. I started off going, muscles, muscles, man, you got to do muscles everywhere all the time. And the deal is that now I'm like, all right, kind of got to pick them up at the end here or something. So I have a very different view on the body after, well, it'd be pretty sad, wouldn't it? If I went to school for 30 people, I did all that I've done and I'm still sitting in the same place. Well, fascia is everywhere. Fascia is everywhere, okay? And there's a superficial, a middle, and a deep layer in fascia, okay? There's all these layers. And the deal is that the superficial, if I could peel my skin off, I'd still be here on the superficial. The middle layer is around everything. It's around everything, and it's everywhere. It's layers and layers and layers in my pelvis. It's layered around, it's around my muscles. It's around every organ, okay? It's around every organ. It just has a different name in different places, okay? So the fascia that's around my bone is called the periosteum. And the fascia that's around my kidney is renal fascia. Around, you know this one, around the heart is actually pericardium, right? And so, and here's the deal is, all this fascia communicates. You have no idea how many things that fascia actually does. So one of the things that it does is maintain structural integrity. It creates a support system, because it's everywhere. It is also protection. It's a shock absorption. The biggest example of that, of its ability to absorb shock, but you have to realize all the fascias are doing that, is your IT band. You know this band that's on the outside of the leg, that when you massage therapist or a PT or somebody gets a hold of you and they start rolling on that sucker, well, that guy's supposed to be tight because it literally is your shock absorber. For every step you take, for every step you run, it's your shock absorber, and it's a thick piece of fascia that does that. The hemodynamic processes, meaning that it's keeping a pressure dynamic within the body. It has an immune defense system within it. It has communication and exchange processes. Hormones are actually going through this, okay? Hormones are actually going through the fascia. And it has a biochemical process also, same deal, where it's going through the fibers of the fascia. So fascia is something that I've come to really respect and that I have come to work on more and more and more. You know, I really have this great respect for fascia. I mean, here's a perfect example, okay? So, your small intestines, all those 22, 24 feet of your small intestines are all inside a fascial bag. That fascial bag is called mesentery. And the mesentery, actually, they just found out, is an organ in itself, but it is fascia. They just came up with that. I don't know if you saw that in the news in the last year, where they say that fascia, that the mesentery is its own organ. But, so here we have this mesentery, this bag of fascia, and what does it do? This bag of fascia, I mean, here's the deal. It contains all my small intestines, and what it has, it's attaching on the front side of the inside of my lumbar spine. So we have this fascia that's attaching on my low back. So here's the deal, is that my small intestines, around 80% of the absorption of all the nutrition in my body is happening in my small intestines. And what's happening is we're having an epidemic of inflammatory conditions going on in people. I'll say it at least in this country. I don't know where, I can't speak for others, but we have this terrible inflammatory thing going on with people with their what's happening in their bodies and their small intestines. And this mesentery is also being affected by this, and it's also attaching to my lumbar spine. So what does that mean it's going to do to that part of my body? I mean, it's going to change my lumbars. It's going to give me low back pain. One of the biggest reasons for low back pain, there's two major reasons that people have a lot of low back pain. One is because of the small intestine and what's going in there, and the other is because your kidneys live right here. Kidneys live right here at the top of the lumbars, and they make the fascia, they grab the fascia and give you low back pain. They grab the fascia because they are having a time, and they give you low back pain. You know those little kids that you see that come out and they walk like this, they're walking on their toes all the time? Well, that's because their kidneys are so tight that it is pulling so hard on the fascia that goes down the back and goes down the back of the legs that they can't even straighten down their heels to walk on their heels. So they do all sorts of weird things in PT for it. My first line is, where's the cause of this? So it's one thing to try to get and work those muscles or make range of motion with the feet, but it's a whole nother thing to say, hey, I need to take care of what it is that's actually where it's really coming from. Now you guys are going to go out there and you go, wow, that guy's a toe walker, you know, because you'll see it, you'll start going, oh, yeah, oh my gosh, you can just see the inflammation in their small intestine. Don't you do that, Jillian?
I do, all the time now.
Yeah, Laura even does it, she's not even in school. All right, so fascia, big thing, definitely learning. And in fact, this is a picture of some of the layers of fascia to show how interconnected it really is. This is the song where my knee bone's connected to my nose bone really comes from, is because fascially, all of the layers, and there's so many layers, are interconnected, and we are one thing. We truly, I mean truly are one thing. So the person who was, where I went to osteopathic school, which was in Canada, and I was up there for 5 years, a French school, and it was a Frenchman that that was the head of my school, and he was kind of interesting, but you know, he was brilliant, but you know, I love the French. Actually, I always want to go over to France. That's where I always want to go if I'm going somewhere. But the thing about it is that as far as them administratively and sort of going down the line straight, not so much. You know, it's kind of like, whoa, you know. For me, I think pretty linearly. So anyway, but he came up with, the head of the school actually came up with this very interesting thing. It's called the central chain of fascias. So now we're coming off of, right now in this moment, thinking about the fact that the fascia is connected to everything and it's interconnected. Well, we are really, so this is another system. So now we're just coming off of fascia. Now there's a central chain of fascias, and this means that from here, the very top of my head, that's what that means, the vertex, and then there's a place in the middle of my head called the third ventricle, and it's running down. This is also in my head. This is the deep fascia of my throat. This is, forget that it says all of this, but this is the fascia that's around my heart, the pericardium, and then it goes right through my respiratory diaphragm. There's a ligament right in the middle of my liver that's attaching. Then what's happening is that it goes through here to the mesenteric thing. I'm going to do this differently. It has too many. It has too many here because I just don't want you to get confused. So here's the deal. It goes from the top of my head, the vertex, to the center of my head, this third ventricle, to my throat fascia. This is my throat. Then it goes deep. This is the deep, it's not my throat, but the deep neck fascia. Then it goes here and it goes to the fascia around my heart, okay? Then it goes to this big ligamentous fascia in my liver. Then it goes into the fascia of my small intestines, okay? Then it goes right above, whether it's my prostate or my uterus, right here, it goes to the top of that, and it goes here to my pelvic floor, okay? So I'm definitely connected through all of those. So if I have a disturbance somewhere in something, it ends up affecting the entire chain. See what I mean about getting some education and some critical thinking? Is that I just weirdly enough had a client the other day, and I don't always think this way. You know, I have a lot of clients, and I don't always think this way. They came to me from, gosh, I can't even remember where. They came to me and they were like, oh yeah, I remember. They live in Colorado, and then they came to me because they were feeling like they had to pee all the time. That was what the deal was, is that this person felt like they always had an urgency to have to go to the bathroom. So, you know, in my mind, because, you know, even though I'm going to be open when I take your history, and I'm going to listen to all that's happened to you, and then I'm going to make my assessment, but you still have ideas, like ideas are coming, even though, you know, even though I'm just waiting for your body to sort of tell me, because the treatment plan is always in the body of the person that's in front of me. So anyway, and the weird thing is that what his biggest thing was, is that this was so tight from the top to the bottom. He had fallen off of a roof and broke T7. And they took ribs, and they took his ribs and built him a new vertebrae. Put a cage in and built him this vertebrae. So right in this area, right in here, at his T7, right between his heart and his liver, you know, well, the heart is like, the heart's between T4 and T5. So just below the heart was where, and the back was where he actually shattered that vertebrae, and they went in to rebuild him another one. And what it ended up doing was, it ended up tightening him going this way and tightening him coming this way. So his pelvic floor was like pulled up, and all the fascia that was around his bladder, okay, his urinary bladder, was so tight because he was being pulled to the center of his body, down this, through this whole fascia. So I had to let go of, because I first held this area. I first held the bottom, the pelvis, and it was like, yeah, but it's not starting here. I can feel the tightness, but it doesn't start here. So I have to look for, where is it starting from, right? So that was the deal for him. I mean, and that's the whole piece, is that you may get an idea, because I had this idea that I was going to free his bladder and go in the pelvic fascia and do all that stuff and get him all free down there. And as soon as I went up and I started to do the rest of these, then his body relaxed and he actually stood 3 inches taller. Because he was I don't even know what the word is. You know, he was kind of collapsing forward like that. So there's some extra ones in here which we really should. Here, like, yeah, okay. So here's the interesting thing. If you look more at mine here, at all of these. So here we have. Okay, ready? Here we go. Isn't it all on the chakra system as well? It isn't, you know, there isn't just like, oh, well, this is just this and it stands alone. No, no, no. I mean, everything is interrelated. So here we have our pelvic floor, and here we would have our mesentery, and here we would have our liver, and our heart, and our deep throat fascia, and the third ventricle and the vertex. So we have them, and all of them are actually gland organ related, as these all sit on the glandular system as well. So there's no such thing as, like, this is an independent thing from anything else, okay? And then we have a system, and I don't know why everybody always thinks that this is all I do, is this craniosacral system. So, is everybody familiar with the craniosacral system? Not so, yes, a few yeses and no's. The craniosacral system basically is, one part of it is that the membranes that are around your brain, okay, there are 3 layers of membranes, and they are fascia. 3 layers of membranes around the brain, and they are fascia, okay? And what they do is, the outermost layer is very protected, and it's connected to all the bones of your head. And then it anchors on the very base of your head. It anchors, here, guy, on the big hole, okay, the foramen magnum. It anchors there and becomes the tube that goes around your spinal cord. So it goes down around your spinal cord, and then it goes down and it attaches on the sacrum in my low back, okay? So that's why it's called craniosacral system. But not only is it made up of the bones of your head, those 3 layers of membrane and your sacrum, but it also has a fluid that circulates around your brain and spinal cord, and fluid that circulates within my brain, okay? So there's fluid that circulates around it and fluid that circulates within it, okay? So one of the reasons why and I'll talk a little bit about this later, is that the cranial sacral system is so important is because it is one of the biggest. How we're doing here, cranially, how we're doing dictates like how we're doing, because it is part of your auto-regulating system. So this system in my body, this, will dictate if I have tensions, torquings, low fluid movement, tensions in the bone, tightness in these membranes, what will happen is that I will have, so there's a whole bunch of physiological symptoms, and there's a whole bunch of sort of psychological symptoms. So the physiological symptoms are, I don't sleep, I can't fall asleep at night. So in my history taking, I'm gonna take that. I know if you can, I even ask little kids, so do you lay there a while, or can you fall asleep right away? And then I ask another question is digestively. This will disrupt your digestion, put you into constipation, really, really, like, yeah. The other thing it does on a physical level is make your muscles tighter. Makes you tighter, okay? You know, kind of makes everything tighter. What else does it do? It raises your blood pressure. Suppresses your immune system. These are all good sounding things, huh? Sounds good. The other thing it does psychologically is the grouping of psychological ones, and these are all the same symptoms. I'm sorry, Joe Blow does not have a different set of symptoms. He may not have all of them, but if the symptoms are the same, it is regulating all the automatic processes, but it's also regulating my anxiety, my aggression, my depression, my shyness, okay? My worry, panicky feelings. I get very worried about things, nervous about things. These are all within having lots of tensions or some things going on in this craniosacral system, which is why it is such a big part of my work, of the work that I teach. So the other piece of this is that if you have somebody whose craniosacral system is on high or really super tight, you cannot change anything else. So the people that come to you, to me, to us, and say, well, I've been to everybody, but nobody can help me with my blah, blah, blah. Then you have to, me, has to take a step back and go, is that because this system is the one running the show? Because if this system is run, this is what I mean about the treatment plan is in the individual person. Everybody's body and treatment plan is in you. It's not in me. There's an ego place in me to if I'm going to decide to tell you what you need. I know what you need. It's like, no. Actually what it is I have a toolbox. You know what you need. And I'm going to come in and reach in here based upon what you tell me and what you're exhibiting and what your history is and what I'm palpating. So this is one of the other reasons why I think the craniosacral is so important. Right now in the world of body work, which many of you don't know, is that a lot of people think that, you know, they should just do cranial. But I don't think that that's actually comprehensive enough. And cranial is part of osteopathy. Cranial was, osteopathy came in the 1870s. It was, somebody was in the Civil War, a doctor, and realized we needed to treat people more holistically. And so it began that way. He ended up with a school, and in the 1890s, one of his students was looking at the head, the skull, and had some ahas, and that's when craniosacral started to be he started to figure it out. And so it was originally under the umbrella of osteopathy. Because once again, we're not out there with nails, and we're not all hammers. So I also have to know when I have to apply, what do I have to apply? And this is being able to work with the craniosacral system is huge, but it's not the end-all be-all. It's definitely not the end-all be-all. It's another one of those systems. So is my issue, my core issue, is it in here? Is this where I have to start? Right? Please, if you have a question or you have a comment or anything, You know, I'm all about it. So there's just the different bones of the head, just showing you some of the different bones of the head. You know, in the medical system, many people think the head is one thing. It is not. It is not bones that are moving like these bones are moving, but there's some inherent movement within each of these places where the bones do meet. They do. So cranial sacral is a part of every one of the modules. Okay. There's also a fluid system in the body. There's many different fluids and fluid systems in the body. We have blood, we have the lymphatic fluids, which is part of the immune system, and we have the cerebrospinal fluid. Is my issue in one of the fluids? I don't know, could be. Could be that let me say this, is that everything that happens to you actually gets imprinted in these fluids. Does that mean that it's the core issue? Not necessarily, but don't think that it's not, you know, that these guys can't be the core, you know, in the core. Because the other part of this is that, so we have the blood, which is just miraculous. I mean, the blood is amazing. We treat it badly, but it is amazing. And we have this lymphatic fluid, right? And this lymphatic fluid is circulating through our bodies. And here's the interesting thing, it goes back into the bloodstream. That's kind of interesting, isn't it? That the lymphatic system eventually goes back into the bloodstream. And here's my cerebrospinal fluid circulating around my brain and spinal cord, and it actually leaks out where the nerves exit the spine. And what happens is, it gets picked up and goes back into the bloodstream. I don't know. I don't know what the deal with that is. But many years ago when I figured that out, I was like, oh, there's something really big about that. No, I don't know what it is, but it's really big, isn't it? It's like, wow, everything ends up going back into the bloodstream. I think that that's just an amazing. There's something super powerful about that, and this is what I say often on a very material, physical level. Everything that any kind of bodywork person is doing, when you're doing massage, chiropractic, PT, or whatever, the deal is that what you're doing is you're releasing the fluids. You're not letting the muscle go. You're not putting the bones back where they should be. You are actually creating a scenario so that my body can actually let the fluids circulate more. That's a very different viewpoint than goes, let me lengthen a muscle for you so it doesn't hurt anymore. That has a very different character when you start to think about it systemically. You know, that's my thing is let's think systemically so that we can understand the body. Just showing you just a picture of how the blood system actually works. And here's the lymphatics, and that they're all over the body. And actually, it shows a lot of them up here, but actually most of your lymphatic stuff is happening in your small intestine. And actually, what the deal is, these are the lymph nodes, but actually in one layer, I just saw the picture of this, one layer inside your small intestine. So you have a really, really thin, the inside of your small intestine. So you have a very thin layer, epithelial layer inside your small intestine, and then right below it are all of these cells that are mast cells, and these are where your immune system are. So that's why it's so easy, because you don't have that in your large intestine, and you don't have that in your stomach. So that's why it's so, so, so easy for your small intestines to get itself into trouble. Okay, and then we have the fluid that circulates around the cerebrospinal fluid. Everybody okay so far? We doing all right? Good. Okay. This is a system nobody thinks about, this pressure system. And here's the deal, is that we are pressurized. And anybody who's gone and cut into an animal, which hunting or anything like that, the air comes out, right? So we are pressurized. We are too. But what happens is, so we have major structures that create the pressure. So we have the thoracic diaphragm, meaning that there's a diaphragm that goes this way. We have our respiratory diaphragm, a pelvic diaphragm, and we have one in the middle of the head, which I'm going to show you the pictures. And all of these are structures that go horizontally across the body. Nobody else goes horizontally across the body, just these guys. Everything else is a longitudinal deal, okay? Except for like your liver sitting where your liver sits and stuff like that. But basically, everything else is all going longitudinally, while you have these, and trust me when I say, all of these are made out of thick fascia. Love that fascia. Me and fascia, we're like this, you know? Because it's like, these are all fascia. This is fascia. Fascia plays so many amazing roles in the body. So here it is, a picture of, this is representation of my pelvic, my respiratory fascia, my thoracic, and it doesn't show you well, but this one in the middle here is the tentorium and the fascia in the middle of the head. This shows you, okay, so these are my main dudes, and it doesn't show me the one in the head. These are my main guys, right? Thoracic, respiratory, and pelvic. But here's the deal. I have diaphragms in my wrist, my elbow, my shoulders. I have diaphragms in my knee, on my ankles. And pardon me, one of the biggest diaphragms that people don't know is actually a diaphragm, is actually your plantar fascia. So the fascia on the bottom of my feet, right? That is a diaphragm. It's a pumping diaphragm because it's going to help pump fluids back up my body. But it's a diaphragm, right? So I have all of these diaphragms. So here's my respiratory. This is us looking up from the bottom, and this is us looking from the top. So the respiratory diaphragm is the diaphragm that's more muscular than fascia, but it's kind of encased in it. But I have important structures that run through it, but this is something that runs transverse. Kind of looks like a bit of a parachute in there. And this is what I always say, is that if I got to work one muscle in the body, only one, I'd work this one. And why? Is because the respiratory diaphragm, unlike all the other diaphragms or the other muscles or the other fascia or anything else, this is the only thing that's in relationship to every single other system in the body. It's in relationship to every one of the other ones. I won't get into the story of how it is, but just trust me. Every single thing else, visceral, cranial sacral, blood, immune, it's got cranial nerves going through it. It's like where it's at. So this is a huge, huge, huge structure to actually work. Then I have the pelvic diaphragm, female, that's male. So we have a lot of fascia, which it doesn't show. And then here inside the head, so there's his nose, but you can't see it here. Here's the guy's nose, and here's a fascia that goes from behind his forehead to the back of his head. But this part right here is, and this is if we're looking down on it, it looks like a horseshoe. That's the tentorium, the one that's in the head, that's a horizontal structure going through the head. And the three main ones, I don't know what's next. No. The three main ones, the respiratory diaphragm, the pelvic diaphragm, and the tentorium in my head, these are the main ones that are in they're like communication big time with each other, okay? So they're really working off of each other. What happens when you see somebody with a big gut, okay? That pressure, what you have a tendency to see is something, give me 1 second here. So you may see somebody from a side view, here's the nose. From the side view, you may see somebody with a bigger gut, right? So that means my pressure has gone much too, it's almost like too big and too tight at the same time. And what ends up happening is, this guy's got a little nose for this, is that his thoracic system up here is going to get small and tight. You see this on these guys? It's especially a tendency for a man to get this way, is that you've lost your pressure here, and what it does is super tighten you you know, in your pressure inside here. Who's inside here? Heart and lungs. I don't want that going on in my esophagus. I don't want that going on in me. Do you know what I mean? So when your pressures start to change, then it starts to do things. One of the biggest things that people don't realize as part of the pressure system also is that dizziness and vertigo. So you have people coming to you for dizziness and vertigo. It's coming out of part of it is a how do you say that? Like the pressure system is off.
Imbalance.
Yeah, imbalance, thank you. And the other thing that's really big, and of course it's coming out of the same place, is ringing in your ears. So ringing in the ears is also coming out of a place of an imbalance in the pressure systems. It's not like just doesn't come out of nowhere. It doesn't. It doesn't. You know? So, what? Oh, yeah.
Is that why you see a lot of varying symptoms in pregnant women?
Yes. Oh my God, that's beautiful. So her question was, is that why you see varying symptoms out of pregnant women? Yes, they're one of the big ones where when you're pregnant, your pressure changes. Absolutely. Good point. Absolutely. Big pressure change. Big pressure change. So on a pregnant woman, I'm always coming and saying hi to this guy. Mm-hmm. And if, well, okay, I was about to go down a little rabbit hole there. I caught myself. I was going to talk about, you know, morning sickness and stuff. So, yeah. So another piece is of these systems where things are possible for something to be off here is the visceral system. That's the organ system, right? So here we have this perfect example. I always love looking at the cadavers because then the cadaver slides pictures. And you know why? Is because I really like to see like what's wrong with them. Is that terrible? Like, oh my gosh. So here's this person. Here's their heart sitting between a right lung and a left lung. Left lung is always smaller, right? Here they've kind of cut away most of the respiratory diaphragm. Here's your respiratory diaphragm. On the right-hand side is the liver. This is the left lobe of the liver, and you can't see the right lobe of the liver. This is the stomach, okay? This is a curtain of what they call omentum, which is fat that hangs off of the bottom of the stomach. There's a lesser and a greater. This is the greater. The lesser you can't see. And these are our intestines, okay? This is our intestines. So what's wrong with this person? First of all, their stomach is like, oh my God, it's enormous. This stomach is swollen like huge. And it's been swollen for a very long time. Because look at the size, something's going on, because your liver is your master digestive gland, organ, I apologize. And so the liver, I should have the liver fill this space like this. Look how little that liver is. Look how little that liver is. So also, because of this, remember, the liver is really, really small. And so I don't know, like, did it ask the stomach, are they eating things that were irritating the stomach so badly that it just blew the stomach up? And is there also something that's the liver can't process anything, so the stomach is having to be called on to do a job that it's actually not supposed to do, you know? So I don't know, because, you know, that's what I say is like when you're doing body work, it's like being a detective. You're just curious, and you just have to keep being curious, you know? There's no answer for me here, of course. But the other thing that I want you to notice is this. Look at this side of the body versus how crumpled up that side looks. Now we have a liver that stuff is going on way wrong, like way wrong with the liver. So it has pulled this hip up and shortened up the amount of space that you can't even see the large intestine. The only place you can see the large intestine is here. I should be able to see the large intestine here, and I should be able to see the large intestine here, but I can't, because this person is so kind of swollen and pulled together, that what's also happened is that the large intestine is getting forced all the way around to the back. So when this person comes in, what kind of pain patterns are they going to have? This person is going to have pain in the low back. They're going to have pain in their hips. They're going to have pain, they're going to have a lot of pain, I'm telling you. They're going to have a tremendous amount of things wrong, like definitely, if they, whatever their autoimmune stuff is, I wouldn't know that. I wouldn't know what's going to be looking like in their autoimmune profile of what it is. I can only talk about what's going to hurt, in their bodies. So the hip is going to hurt, probably the leg is going to hurt, the shoulder is going to hurt, because of what's going on with that liver. But at the same time, the spleen is somewhere right here next, just tucked right in there, and that spleen has got to have been running. So they probably have pain here. They have probably stuff going on in that left shoulder as well. Personally, I just find the body fascinating. I really, really do. I find it super fascinating. So we also have an electromagnetic, let me go back. So let me just say this about the visceral system. And this is one part, first you have to go through the whole body. I'll talk about this until you get to the organ part of the body in the teaching. But there's a French doctor. He's probably, what is he? He's probably 85 now. And his name is Dr. Visceral. And for anybody who's in the field, and a lot of people are not, and few people are in the field, Dr. Visceral many years ago, came out with visceral manipulation, meaning working on organs, all right? And Dr. Visceral estimates that all the pain in your body, you ready, is somewhere 65 to 90% of the pain in your body is coming from an organ. So, if I go around and I'm only working on your muscles, and I go around, hey, if I'm only working on your fascia, there's fascia around every one of your organs, so I have a good chance of getting something, right? It's something there with that. But if I don't know how to work your organs, I gotta tell you, the biggest thing that gives you the most pain patterns are your kidneys. Oh my God, the kidneys are, there's nobody here in group 3. Oh my God, they have it close, they're close to getting to the kidneys. So the kidneys make so many problems, I can't even tell you how many problems the kidneys make. So this 65, at first I was like, yeah, 65% of your pain. No, he estimates that all the way up to 90% is possible to be coming from your organs. Isn't that, that's like friggin' amazing, So another field that people don't like, they're tossing off is the electromagnetic field. We all have an electrical field. We do. Everything has an electrical field. Everything. There's nothing on the planet that doesn't have an electrical field. It's not electrical charge, it's an electrical field. And one of the things with our electrical field that although I don't specifically have techniques to show you, the more you balance the body, the more the electromagnetic field goes back into its more normal, neutral field expression. But the funny thing is that what is messing us up the most? All these EMFs. 5G, they've estimated 5G is going to wipe out a big percentage of the planet. And what's the biggest symptom that we see as body workers when somebody's electromagnetic field is off? Biggest symptom, and what do we hear all the time? Heart arrhythmias. Because you have an electrical system that works in your heart. Your heart is an electrical, it's a muscle, but it's run electrically. And what happens is that when these electromagnetic fields are going on and they're doing all this disruption piece, it disrupts our own field. It disrupts our own field. It's kind of a big thing. And then we have something called the morphogenetic field, which is the collective unconscious. And we are connected to the collective. We are. We are connected to the everything. And, so the question becomes, here's the question. The question really becomes, where is the core of your issue? Is the core issue because you've lost a lot of your family and now you've gone into a piece around that? Is the core issue because I'm just eating poorly or doing something that's really hurting me that way? Is the core issue in my craniosacral system? Is it visceral, you know? Is it in my fluids that I have to get the fluid circulating again? So that's the question, is where is it? And that is what, I mean, we cannot, like almost, no, I shouldn't say it that way, but it's like me personally, I have to teach this way. I have to teach what is the interconnectedness between everything. And starting just literally, anatomically, what is, like, anatomically, what's the interconnections? You know, if I sprain my ankle, I can begin to have jaw pain. Why is that? You know, it's like, if you begin to know your anatomy and the interconnections between things within the body itself, you can get to understand on a bigger picture, like what is actually happening and how can I help somebody through something. It's a, you know, it's a big question. It's a big question. And I'm not interested personally in having somebody come that I have to see them weekly in order to have them maintain. I'm not interested in maintaining unless I have somebody who has some kind of illness that goes beyond, and that's a different story. But I'm not, in the general sense, gonna, you know, actually want to go and maintain with them, you know? Because one of the things that's also important to understand is that there are stages of health, okay? There are stages of health. So the healthiest one is where something happens and I do an adaptation and then I'm back to normal, right? So that's the one stage of health. This is where I'm fairly healthy and something happens to me and I can contain it. My body like does a compensation and now I can contain it. Then what happens is I'm carrying a few too many of these, and the next one that happens is I begin to break down a little, right? So I'm breaking down just a little bit. And this is the place we tend to see a lot of people in this degeneration, in this decompensation place. When people start to get into degeneration and pathology, it gets harder to bring them back up to health, you know, because that's the thing about this school. I'm working with your health. I'm not working with your disease. I'm coming to ask, where's the health that's presiding in you so that we can like bring it up and bring it out, you know what I mean? We want to bring that to that's what we want to bring out to the party. I don't want to focus, I mean, this does not mean that I'm not helping eventually with like the symptoms and all of that stuff. You are, but it's from a place of where did I feel the health and how can I help that to rise? So these get a little more tricky to try to help somebody, especially when they're in pathology. You definitely, a lot of the time, you're needing other practitioners or other medical something that's happening here. But as we begin to go along, how do I say this, is that the more you don't like get help and help get things out of your body, the further down the line you're going to go here, you know? The further down the line. So I thought what I would do is take a break for a few minutes. There is a bathroom. We're going to turn the light on so you can see. There's just one, I'm sorry. There's a bathroom there. The other piece of this is that which system is it in? Which system is it in? Like, what is it really, who, what, where, why, which one is it really truly in? You know? And how do these things work? I mean, throughout the 2 years or whatever it is, I'll speak to all that in just a second. Throughout the whole time is that I'm always giving, like I just said, where the kidneys are some of the biggest drive so many of the big issues in the body. They drive so many of the big issues in the body. So when I'm teaching, I'm teaching you anatomy, I'm teaching you these things, but I'm also giving you the clues. I'm not making you like you have to figure it out. Like, you know, 2 syllables, no, just kidding. I'm not doing that. But that, you know, is that I'm always telling, like the liver creates headaches and sensitive eyes and higher allergies to foods and to everything, and you know, so I'm always giving you what the whole look of the whole thing is. Yeah. So I was going to give you, you tell me if we want to do this, I was going to give you just an example of like something that actually echoes through all of the systems of the body. Just, I'll do that kind of quickly, is that I'm not known for my drawing capability. Would you like this light on or would you like this light off? I don't care. Is it helping? Off? Off?
Yeah.
Okay. It's ugly. It's ugly. I normally teach with that off, so. Okay, so I suck at drawing. We're going to do a little try here. You know what, here, make it a little Mercedes. Okay, here we go. This. Steering wheel. Okay, and then I got, oop, 10 and 2. 10 and 2, right? Okay, so, yep. So what happens when the other guy now, right? The other guy hits me, right? Yep, getting whiplash. And here's the little interesting factoid about whiplash. The interesting little factoid is that, and I don't know how to compute how fast my car is going and how fast your car is going. I don't know how to compute this. All I know is that this range, okay? There is a range that if he's going 30 and when he hits me, whether if I'm stopped or going 30 or something, when this hits me, my head whiplashes like forward and backward, right? So I get a forward and backward thing. I get a is that if he's going 30, my head is going 5 to 8 times as fast as the car that hit me or the rate that got hit. So my head and neck are now going, what is that, 150 miles an hour? Hi, hi, and you know this whole crazy nutty thing about how if you don't have symptoms right away from a car accident, that you don't have symptoms, right, is that then that didn't happen from the car accident. But the other part is that, and boy, I just heard this on a commercial or something, is that how many people have pre-existing, you know. Most people have a bunch of pre-existing things when they have something, an injury happen to them, so that it's very difficult to sort of say, well, that all came from the car accident and stuff. But, so what happened? So first of all, we had something happen in the musculoskeletal system, didn't we? Because not only did it get me in the neck here, but it gets me usually in the low back as well, okay? So it whips me front and back into the low back, okay? And then what other big systems that are affected when I have a car accident is also the visceral. I can't spell. You guys will learn that if you take my class, you're going to learn that I cannot spell. So here's the thing. Good thing is I can do body work and I know anatomy, so I can spell anatomy things. Isn't that weird? Okay. So the other thing that's happening, I got to get a different color because that is, you got to get a blue one because one of the biggest, so you got to write this down so it's one of the biggest things, here it is that in a car accident, and this never gets looked at, except for by the people that come to my training, right, is the fact that you're wearing a seatbelt. Oh, I hope you're wearing a seatbelt. You know, you're wearing a seatbelt. And I don't care whether you're the passenger or you're the driver. Your seatbelt is doing this, or your seatbelt is doing this, right? So it's one or to other, right? And who's right here? Your heart. Exactly. Exactly. Your heart is right there. And one of the things that it does is when the seatbelt locks, it locks your heart up. Okay. Okay, here we go. Here we go, guys. Is here, okay, I can't draw a picture of a heart, so, you know, here's your heart. I'm not good at this. Okay, so here's my heart. But here's the thing about my heart. And I told you I love this system of the fascia. See, here's the deal. Is the fascia, the pericardium that surrounds the heart, okay, has ligaments in it, and it ligaments itself to behind my sternum, so it ligaments to the sternum, and it ligaments to the vertebrae, okay? So we have, it has ligaments to the sternum here, and in the back it has ligaments that go towards the back, right? We have some, whatever. And here's the other big thing. This is the big thing, big thing. And if you guys get on my, Facebook page, I made allusions to it a couple days ago when I showed the guy with the kyphosis, is that here's what also happens. Here, that's too funny. Okay, so here are my cervical, my neck vertebrae, right? And here's what this does. Goes up and attaches to the front of my neck. So, when that car accident happened and I whipped and it locked my heart down, it pulled my neck. So it don't pull my neck forward just because I went like this. What it does is over time do this. You ever seen people looking like that? I got it. I had a terrible car accident. Well, I think it's terrible. I wasn't taken to the hospital. But you can see that I'm in front of my own neck. I'm in front of my own body with my neck. Is that the neck starts to go forward. And the thing about it is that this is never the equation. Never in the equation is it that it's a visceral issue that happened to your heart. You let that heart go, then you let the neck go. It's not that I don't have to let the neck go once I let the heart go. I do. I have to work that symptom. But I don't have to work, but I do have to work this part. This is one of the missing pieces. This and that there's muscles on the front side of the neck that also get it really big in whiplash. Big, big, big. Big, big, big. Big in whiplash. But everybody works the back of the neck. They work the back of the neck, the alignment of the vertebrae, the back of the neck. But what they're missing is the soft tissue stuff, the visceral and soft tissue stuff that's happening on the front. You know, when somebody's starting to do some of this stuff and everybody gets all involved in working on their back or massaging the back, is that, no. I have to open this part and then have their body be able to accept. Because now their weight's here. Who's holding them here? Fascia, which is now doing a job it's not supposed to do. As soon as you're off yourself, your muscles and your fascia are now doing jobs they're not supposed to do. So in this car accident, so not only did I get musculoskeletal, I definitely got visceral. I'm going to have my brain inside here is going to hit inside. So I'm going to get that coup and contra coup where I'm going to get some injury to my brain. So those are just a few of the symptoms that are affected by this. I know. Do you get it? And I didn't even talk about what the lap one is doing. Is sitting right underneath, it's getting part of the small intestine just above all the sex organs and all of that. So it's like, yeah, wow. So when you have a whiplash, one of the things we want to do is we want to think about, all the parts that become involved with that kind of an injury. You want to be on top of all the parts that happen in all those kinds of injuries. Anybody have any questions? Yeah.
How do you repair this fascia that's been damaged?
I think that would be 2 years and 2 months worth of coming to I think that's how we talk about that stuff. I think that would be it. That's the funny thing is, that's the hard part. I post on Facebook a lot, and I don't post about my dogs, I post about the body. And although I know something, isn't it funny? One time my little Ruby girl got sick, right? My little Ruby got sick, and I posted her on there because I was just having a day like that. My Ruby girl's sick, and oh my God, I got 105 comments. I post about something like this, and I get 2. I'm like, what are we? We're a little messy, okay? So anyway, but the funny thing is, John, is that a lot of people will message me and ask me, so how do you take care of blah, blah, blah? And it's like, woof. That is why I never on my Facebook page tell you how to do anything. I just tell you the interrelations, because it's dangerous. It's dangerous to start telling somebody how to start dealing with any of that stuff. Plus which, it took me 34 years to get here. you know, and it's a process. And even in school, because the only one we have in school is Jillian, is that it's a process. So I'll start by saying this about school, is school is 2 years and 2 months long. And it is 4 days, and it's always Thursday, Friday, Saturday, Sunday. It's 4 days, and it's every other month. So, and the reason why is because you're sitting here listening to me talk about this, and you're going, oh my God, right? You're just sitting here going, I am overwhelmed, right? So this is why it is not a straight program of 5 days a week, or it happens every other week or something, is that you need the time between to process. You also need the time between to go to your job. You know, you need to be able to continue to function in both your life and all of this. So we have, which we can give you at the end, is we have the list of all the dates. The next class, I start 1 class a year. 1 a year. Right now I have 2 going on. In January we'll have 3 going on until April when we graduate 1 of the classes. So I start once a year, and that first class, man, that first module, it's my fave. And it's my favorite because my school is based on learning and understanding the principles of the body. Because we have, there's principles. There's a language and principles to the body, and it is all about learning the language and also learning these principles. So the first day is the most city-downy day of the whole, you know, training, because I'm telling you all the principles. And it's some of what I've told you already that I did here, but it goes much further and much more into it. And then we spend the next 2 years applying it. We spend 2 years applying those principles, because it's like, it's that thing, I wish I could think of a different one, but you know, if you feed a man a fish that he eats for a night, but if you teach a man to fish, exactly, he's got a lifetime. So we have that. So that is what the format basically looks like, is those 4 days every other month. What's expected in between is for you to work on people. And we have client review sheets that are like 4 questions long that your client fills out, and you have to do, I don't remember how many between, 4 or 5 in between. In the 2 months, you have to work on 4 or 5 people, but you can work on 25 people and you just be getting better. That's what happened. Yeah.
Can they be the same people all the time?
Yeah, you can do the same people, because they'll also notice that you get better. You know what I mean? Yeah.
So is one of the things you discussed in class how you transition clients to your new way of thinking? Because clearly your way of doing body work is what you trained after this, and they're used to you just kind of doing the muscular, and you're like, okay, now I'm going to flip the script on you. I want to do these things with you. How do you transition into that? How do you go, okay, let's try this?
You know,
And they're like, oh, I just want what you did, it makes me relax.
okay, so did everybody kind of hear the question? So let me ask you a question, is how many massage therapists or people that work in the field already are there here? And that would be you. Okay, so what I would love to do is well, ask Micah how she's doing it, but also to like get some of the other people, and there's a couple of assistants that have done that and stuff. So I don't specifically take a ton of time to do that, to address how to do that, but you know, people are more open when you say that I'm learning something. People are more open to saying, yeah, go ahead. You know, go ahead and try. And one of the first things I teach in the first module is a whole, one of the principles of the body is that the body is organized. It literally is organized. And we teach you how to get back to the organizing principle. It's an awesome one. It's kind of muscles and fascia together. It's the most muscle fascia thing I teach. And people love it. And it's a fallback. And anyway, it is a nice transition for people to come into doing some other slightly different kind of stuff, so sort of baby steps over. Okay, but I'd be willing to talk to you about that personally. Yeah. Okay, so we've got 2 years, 2 months, 4 days, 2 months in between. Got to do some people. The more you practice, the better you are. Okay. And then what we do is we start at the bottom of the body, and we begin, after the first module, we start in the feet, legs, and we have all of this is all listed on the website, of course, is that we go from, you know, feet, knees, and legs in the second module, teaching all that, but you're getting cranial, so you're getting 2 or 3 days of teaching the body piece, and you're getting cranial. And then you get 2 or 3 days of teaching the body piece, and then you get the rest of it is cranial. So the last part is the cranial sacral system that we're also working with. So what happens is we work our way up the body. You know, in the third module, we're definitely begin in the pelvis. We have 2 modules for the pelvis, and we begin the pelvic module, and so it's like that, and then the next one goes to the lumbars, and then we go up to the thoracics, and the shoulders, and the neck, and then we get to visceral. I love that, visceral. I do visceral all the time. So then we start working in the first visceral class, teaches you stomach and esophagus and small intestines and how to work with reflux and hiatal hernias and all of that good groovy stuff, and how to tone down the small intestines when they're inflamed and just make everything a little better. So we have that. So, but cranial's going along at the same time. Cranial is all going along. And in cranial, you are eventually getting, there's method to my madness, is that in cranial we are getting eventually to working on concussions and working on the pituitary and working on the hypothalamus and how to separate the lobes when they get stuck together, because they do all the time. We do TMJ, we do a whole thing with teaching how to widen palates and move teeth and work on the eyes and actually helping with deviated septums, and there's a whole business there, working with ear infections and all sorts of things. There's a big module for doing all of the facial stuff. There is, did you have a question?
Yeah, I was just wondering, when you said about the lobes connecting, does that have anything to do with people with Alzheimer's?
No.
No?
No, it doesn't. And they have all these different theories, you know, for Alzheimer's and stuff. So, and we also embedded in all of these modules is usually it's the 5th module. This time it's going to be traded because of COVID. She's coming in February, and embryology is in part of the program. She comes, I have a doctor comes, and she teaches for 2 days. It's an open, it's included in yours, but what happens is that somebody from the outside can take the embryology. It's 2 days long. She comes and teaches Thursday, Friday, and I'm telling you, when I do the fascial talk on the 11th of November, I'm including how fascia develops, why it's all one piece, and there's a whole embryological thing that I'm just going to do a little bit of talk on. And there are things about learning the embryology that makes you understand the body so much more, and allows you to really, I've had it so many times. I've sat in on embryology, not just in school, but I actually travel different places to go to embryology classes. Is that it's so powerful for you to have the vision of how the development happened, so that when you come into contact with it, when I hold it in my mind's eye, it changes in here. It just changes. It's just so powerful. I mean, one of the biggies is your respiratory diaphragm starts here embryologically, and then what does it do? It starts to pressure. As you start to come up, it starts to pressure itself down, creating part of the pressure system. And one of the things to understand is that respiratory diaphragm, when you're injured or not feeling well, is always trying to go back where it came from. Understanding some of that stuff helps you to actually, it just does. It's like I'm communicating to the body, and the body knows that I know. You know, it knows that I know. So anyway. So embryology is part of it. We do a pediatric day, we do a pregnancy day, all as part of that one module. In one of the modules, there's a big talk on trauma, about what trauma does and how it's in the body and so forth. And so, very comprehensive. We get to concussions, and we get to working the endocrine system eventually. But one of the deals that we have going on is this, is that in the beginning, even if you're a massage therapist, even if you're a PT or an OT or a chiropractor, because I've had everybody in the classes, is that you have to learn how to have the right touch. So that's why we're all starting where we're starting, so that the touch can grow, because I don't want you touching my liver with those hands that don't know how to touch yet. Do you know what I mean? It's like, you know, it's really pretty, it's kind of big that way, and the same thing is cranially. So cranial sacrally, wait till you're in class, okay, is that everybody starts too hard, you know, in order to, you know, there's just a learning curve. I started too hard. Probably not, though. It's okay. That was like 30 years ago, actually, so it was a long time ago. But you know, it was like, you know, I thought, oh, I'm probably fine. I don't know what's the matter with them, though, you know, and stuff. But anyway, but there's this whole learning curve towards knowing how to touch and knowing how to do this. Do you know what I mean? Yeah, Jillian.
One of the things I like best, and I'm the assistant for the school, but I'm also in the school too. And one of the things I like best about it is that we get a lecture first, but then the rest of the time is actually learning the treatments and working on each other with the treatments. So we're actually learning hands-on, practical things that we can take and practice too. And so there's something about practicing with other people that don't know what they're doing yet either, that give you an opportunity to really embrace that and be able to give feedback to each other too. And so it's not like you're just shoved out into the world on people that you feel like you need to really do well for. You have an opportunity to practice and to get better, and that's something that I really appreciate about this school.
And the other thing on that vein, which is one I would have told anyway, is another piece of, I'm going to say this, and I'm going to say it because I've gone to a lot of school. If you've read the bio on me on the website, you're just like, she's done a bit. Is that my school is one of the schools that gives so much support. There is so much support in this school, and one of the things, talking and sort of coming off of what Jillian said, is that we have a once a month where the students can come here and practice with each other. And it's every student in even graduates, even the graduates can all come here and practice if they want to practice, right? So there's this whole practice piece that goes on, you know, with the students, which is really great because there's also students that are graduated that come to answer questions and so forth. And then another way that we have a tremendous amount of support is that there is a private Facebook page for each of the classes. And that page is the way we communicate with you. You communicate and ask questions of us. You ask questions of each other. It also is the page where Jillian puts the link to things, which I'll tell you about in a second. So the link to the stuff. So there's a way in which we're, you know, in and checking. And I get on mostly every day and take a look to see if anybody's posted a question or posted anything that needs an answer from me or something. You can always then email us as well. But that Facebook page is the page for that closed group, period. So what's happening is the PowerPoints before I do them are sent, the link is, I don't know what it is, Google Drive?
It's a Google Drive.
It's in Google Drive. Is that the link to the PowerPoints are there, and the link to the technique sheets are there. So we give you all the technique sheets that you're going to need, and the link is there, and you're going to print off the link, the technique sheets at least. It's up to you, it's up to whomever on whether they want the PowerPoint pictures or not. So those are all coming through the Facebook page. So we have that link. And then we video all of my lectures and all of my demonstrations. So all the lectures and the demonstrations of the teachers and the TAs is all videoed. It's all labeled, and it's also, the link is through the Google Drive as well. A lot of people get an external hard drive and then download them off of there, but you can always get them, they're always there for the Google Drive, and it's your pay, it's your, whomever comes to class. It's the individual groups thing, and what you saw me do. okay? And how you saw me lecture. And that has been an invaluable piece, just invaluable. No other school gives support like this, where you're having all of these things, you know, prior, that you can ask questions, that you can contact us, or that all these things are actually given to you. So there's that. Am I missing something? Okay, so at this point, here is how the money breakdown breaks down. Melissa, where's my rate? I forgot what it was. Okay, so before class starts, there's a deposit of $1,400. That's before class starts. That's just before class starts. And in each of the modules, there is a $700 at each of the modules. That includes the first one. A lot of people ask, does the $1,400 include the first one? So it's all of the modules. Each of the modules is $700. The suggestion for the book is, you know, some people get more anatomy books, but at least just having Netter's anatomy, which we can talk about in class and stuff, whatever. But so it's $700 at each module. And the school takes credit cards. I don't personally in my practice, but the school does. But I will say this to you, is that if you pay the entire thing in full, there is a 10% discount if you pay the entire training at once. There is a 10% discount on the, whatever it is. My school, I think it adds up to $11,200 over the 2 years. And to go to Clary, I'm sorry, I'm going to say this, to go to Clary Sage and get a massage education, it is over $16,000, and you're ending up with a very rudimentary, very basic massage. There's a very big difference between them, you know. We're working on trying to do something that would eventually help students. We're a new school, we're not that far in, and we're just not quite there yet. So have I missed anything? So we start at 8:30 in the morning. We end somewhere between 3:30 and 4 o'clock for the 4 days. You know, we have a little kitchen-y thing, and normally the chairs are not here. It's all tables, and the setup is different. And I think that's it.
When is the deposit due by?
Well, it says, that you know, in the stuff it says the deposit is due 2 weeks before class starts.
Okay.
So the class start, what does it say, January 21st? So the class date, so we'd like the deposits to be in by the end of the 1st, the 7th, or by the 10th, or something like that, okay, of January. I'm good to go now, though, if anybody's got a checkbook. So any other questions? Is there anything I missed? Yeah.
At the end of the course, what
Oh,
would you
yes. Oh,
set
thank you.
yourself up
Oh
as?
my gosh,
Like-
yes, the end of the course. Yeah, that's just done. No. The end of the course is that we are a 500-hour school, and I will say that part of the 500 hours are these clinic sheets, these sheets that you're doing, is that you have to turn in so many of those to make the number of hours, okay? To make the number of school hours. The other thing that happens is in the last module, there's business and ethics one day. So you're getting the whole business and ethics piece, and that is because it's a 500-hour training, and in order to get a license, you have to have some business and ethics as well. And any state in the union, it's 500-hour, you have to have a 500-hour certificate. So in order for you to get a license. So the deal is that you get the 500-hour, once you've finished and you make sure that all of your client review sheets are in, then we give you your 500-hour certificate. With that, because it's now passed sort of nationally that you have to do this, you take a test, there's a test, and we are in connection to them. We send your transcripts to them, and then you take this test, and every one of my students so far has passed. So there's, I think it's like 60% for Clary Sage, and we're at 100% of everybody who's taken it. So people have had to take it over and over again. I forget how many times you can take it. But with that 500 hours and your NBLEX test, then you can go to the state and you can get licensed as a massage therapist. And that's what happens. So you can work under the umbrella of a massage therapist, even though you know in your mind that you're like doing what you other soft tissue stuff. You're doing stuff. But yeah, so that's
Is
what
it
happens.
state by state? Is it just valid in Idaho?
With the 500 hour, you can go to any state as
Right.
long as you have their 500 hours and your NBLEX. You can go into any place else and present those things, and they will license you. You can go anywhere to be licensed as long as that's what you have. If you've finished and you've done that, then you can be licensed. Yes, you can be licensed as a massage therapist anywhere with that. With the you have to have, now they've kind of come across the board, you have to have a 500 hour and this NBLEX test. You take the test. And they have all sorts of, well, also the person who teaches the business and ethics, which is not me, she, oh my gosh, she dots the I's and crosses the T's, and there is no question about your insurance and your this and your that and your all the rest of your stuff. And she talks about studying for the NBLEX and what's the best way to do it. She's awesome. She is really like right on it with all that stuff. Gets you pretty, you know, ready. And then some of the people actually met and studied together who were taking it and so forth. So, and lots of the students meet outside and they trade and they do different stuff. So that is definitely going on. Okay.
I had a question before about what if you miss a module?
Oh, that is a fine question. Thank you, Jillian.
Well, thank you for
What
that.
if you miss
She's
a
the one
module?
that asked.
Oh. If you miss a module, this is the way we've kind of got it set up, is that you pay for your module, even though you've missed it, but you just catch it with the next group. So we have people coming in who, from group 3 into group 4, who, you know, are having to miss. So if you miss a module, you're making it up with the next class, but you need to pay for it, and then you'll just make it up.
And you do receive the videos
Oh, absolutely.
and the treatment pages
Yes, you
from
receive
that.
from that
class
yes,
that you
you'll
missed.
receive all the stuff that you missed. You just have to then literally be in class next time, though, when it comes around. So you're going to be in it a year later, basically, is what's going to happen. Is that if you miss the sacrum class, you're coming to the sacrum class with the next group. That's what happens. Good question. Okay. Anything else that I miss? No. Yes.
Do you have a specific textbook that you work with?
You know, I have a tendency to work a lot of my anatomy slides are under Netter, but as far as textbook for techniques and so forth like that, no. They're techniques that I've put together from all of the training that I've had over all the years. So it's kind of like a compilation, but you'll make a textbook out of your treatments for sure, for sure. And knowing your principles, I mean, are really, really big for understanding what it is we're doing and where we're going. I know, I'm sorry, it's like, here's the deal is, nobody else is teaching this way, and this is like new territory. You know, for the last 4 years, I've been making the maps, you know what I mean? I've been making the maps of this uncharted territory of body work this way, because this is just not what's out there, you know? What's out there is, and it's one of the reasons why I don't do online videos and online teaching stuff, is because there's something missing with that, as well as it's very two-dimensional. And one of the things I'm trying to do is get you to out of three-dimensionality. We're going even past that in the school. So it's like, you know, it's not something that you can teach on a two-dimensional level, you know, that kind of thing. So it's hands-on and being here and interacting with each other and understanding and really touching and being touched and having, you know, all of us come around and stuff. So it's just such a paradigm shift in the way of looking and thinking about all of this. So it's exciting. I'm excited. I love teaching it. It's exciting to me. And it comes out, I grow all the time and understand something and have ahas, which is just awesome. So anyway,
we get to watch this class again? I know you.
Well, right now, there's a Facebook Live going on, and we filmed it just in case the Facebook Live didn't work, so yes, if you go on,
Actually, it's going to be on the YouTube channel.
Oh.
Probably tomorrow, I'll have it put up on the YouTube channel so that we have this class available for people
Okay.
to see.
Okay.
And say name?
Ankrum Institute, that's
Yep.
the name everywhere. Yeah. Should have heard the original name I had for this place. It was like a pair, how did I do this? I was like, it was like, and da-da-da-da-da-da-da-da-da, da-da-da-da-da-da-da. My friend looks at me and she goes, "Lady, why don't you just call it the Ankrum Institute?" I went, wow, that would be cool. I never even entertained that idea. It's like, wow, I have to tell them what it means and how we're going and all that kind of stuff. So it's pretty fun. But it is a different way of thinking and a different way of viewing and a different way of coming into this understanding. And this is a life-changing 2 years. It is a life-changing 2 years. Maybe it's going to change that I used to do this and now I do this, but there's something about being touched and there's something about this understanding at this level that's so, isn't it, Jillian? It's like, it's so powerful and it doesn't have anything to do with me. All I am is the representative of this. Do you know what I'm saying? It's just working through me. It isn't about me, it's about this bigger understanding, and the planet needs this. It needs people who are more in the truth, who are more in this place where I'm not looking at you like this, I'm looking at you like you're whole, and I'm coming to you from my whole to your whole, and just it's a whole, to me that's just where it's at. I just can't. I mean, I've taught the little pieces in a lot of years, and it just all evolved to this, so it's exciting. Yeah.
Plus, you can't get worked on all of these different pieces of your body and not have some kind of transformation and having traumas released and having all of those things happen. And so you're growing internally too as this whole process, as you're learning too, and it's wonderful.
Yeah, it is. Yeah.
What is a typical class size for your training, and then also just what happened during the COVID shutdown with your program? Do you handle that?
Well, class size, there's always an attrition rate. So I started with 16 and ended with 15 in the first class, and then the second class I started with 14, I ended with like 10, and class 3 and 4 are doing the same kind of thing. I don't know how many are going to be in this class. I feel more ready now from a personal standpoint in terms of the evolution of both the school and myself, that the class may be larger. It wouldn't be larger than, I'd say, 20 or something like that. It wouldn't be super huge. If it was, I would cut it in half and do 2 classes. I'd start 2 classes. If I ended up getting 40 people, I'd do 2 classes for sure and cut them into 2 and do them whatever. So that's one thing. So the classes are not super huge, and there are assistants in every one of the classes, okay? So there, besides me, there's at least 2, possibly 3 assistants coming and helping tableside. During COVID, I was shut down. So the classes, that's why it's taking longer for the class to graduate, because they were supposed to graduate in, I don't know when, but I missed time during that. I just shut it down. So that's what happened during COVID. Yeah.
What do you do during snow days?
I'm here. Dave, I'm from Chicago. I'm going to be here. I'm going to come and shovel your drive. You're going to come. The expectation is to get your badootie here. You know what I mean? It's like, I don't care.
Not bad, so.
COVID, I'm canceling. There's no snow days. I mean, if it's really bad, if it was really bad, obviously, and I knew we were going to get something up to our necks or something, or there was a tornado, I might say, hey, go home or don't come. But that's so funny that you would ask that. That is so funny. I mean, oh my God, in Chicago, one of the last years I was in, because I've been here 21 years. 21 years, I've been here 21 years. And one of the last years is that my car was parked. You couldn't park your car like this. The cars are, everywhere. Like here, you don't leave a car on the street. It's like, really? you know, I mean, honestly. Or if you're parked in front of your neighbor's house and there's no, they're like, it's like, oh my gosh. Anyway, in Chicago, you're lucky if you're parked a mile from your house. So one of the deals is I've got pictures of this. I had a Volvo at the time, one of the old boxy ones, and I got snow up to the window, right? So I get down there, and I got a shovel in my trunk, you know, I the snow off the trunk, and I get the thing out, and I dig my car out. I go out an hour early to dig my car out because I got clients. You know, I got clients starting at 7:45 on Saturday morning, ending 8 of them, ending at like 5. So I shovel my car out. I get in my car, and I get to my office. It takes me 45 minutes to get there. And then they started canceling. Oh, it's like, and then here's the worst part. Not even there, but I didn't even tell you the worst part. I get back home, I limp back home. So now this 4-hour jaunt thing has happened, and I get back and my space is filled with snow. Now I have to pull out, take the shovel out, shovel my space. So you, what? No, Chicago.
Okay, yeah.
At least there wasn't a car there.
What's
At least there wasn't a car there.
Oh yeah, no, you know why? Because this is what you have to do when you're in Chicago. This is like, you know, living here is like a dream in some ways. Is that I rented a space behind the White Hen. I had in my apartment building, so that was the deal. All right, so when I teach, here's the thing. It's all about that we're making an exchange. I am not above you. I just have had this experience and know this stuff. So in my classes, we are together. We are one in doing that. If it's going too far off the thing, then I bring it back and stuff like that. But everybody's experiences are valid. Your knowledge is valid. Who you are is valid. All of that is part of the teaching because it is not about me and that I know the deal. It's about me. Usually I'm just excited to tell you. And that we're on that page, okay? Any other questions? If not, we can call it a day. You. Oh, please.
So when you are working with someone, do you receive energies off that person too that you have to deal with?
That is always the age-old question, you know, is that you're getting stuff from your clients and stuff like that. And everybody sort of, or not everybody, but many people see it sort of differently. Some people put energy around themselves. Some people put it up their arms or whatever. I think that, you know, I had a teacher once upon a million years ago who he said that there was a teacher who said that you bring it into your heart and you transform it out. And so however you do it, you know, I don't know. I know that I cannot work on as many people as I've worked on for 34 years. It'll be 34 years in January, so 33 years. I know that I cannot work on this many people and not have their energies and be affected. So you have to do things for self-help. What is your self-help? Is it soaking in an Epsom salt tub? Is it having a Lucille dream? Is it having a massage? You know, what is your thing that helps you to actually do that? Is it, you know, is it listening to classical music? Is it meditation? Is it prayer? What is it? And that is what you do. Because there's just no way to be in the world and not be getting other people's energy. And I don't like to lock, see, one of the problems that's happened to me over the years is that I've gotten, it's not really a problem, it's actually a gift, is that I've gotten more and more open. My ability to read is bigger and bigger and bigger, has gotten wider and bigger and more open and bigger. And so, you know, what do I do then to take care of myself in doing that? So, for everybody it's something, you know, it's individual. Maybe for some people it's playing the piano, some people it's writing a journal, for some people it is seeing or wearing crystals. There is no wrong and there is no right. It's just very individual on how you do that, okay? Not a bad question though. Not a bad question. You know, some people run their hands under cold water. I don't know, you know. Yeah. Anybody else? No? Well, let's all go and get ribs. No, I'm just kidding. I don't even know where that came from.
Do we have the enrollment
oh yes, we
dates?
do. Oh my gosh, I'm so bad at all the papery work. Okay, so what we have here are on one of the sheets is a list of the dates of all the classes for group 5, which is the next class is starting, is group 5. So it has all the 2-year, 2 months dates on them. And this other one is for somebody who is interested, this is our enrollment sheet, just to give us your information to know that you'll be coming into class, and we would, we definitely need the application filled out. And yeah. And the thing that I always say about what's my prerequisite for school, because people have asked me that, what's the prerequisite for somebody to come to this, is here's my thing, is you have a desire to learn, you have a willingness to study, learn your anatomy, and that you have a level of maturity. That's what my thing is. It's not my thing is oh, you've had anatomy before, or oh, you've had this, or you've worked in the field. It's not that. It's about this inner, it's about who you are and how you want to come to, coming to this. So it's a different deal, definite different deal. So, Jillian, did I get everything now?
Yes.
Okay, it does meet here. Class meets here. And you get an hour and 15 for lunch. There's refrigerators and microwave and everything, and some people stay, some people go, and it's like that.
No under chew room yet.
No under chew room, that's funny. Yes. They sat in for my visceral class, and I was telling, because I tell stories, you guys got to get ready. Whoever's staying, this is, if you're staying, you're hearing stories. And like I just told about my car, they sat in on the first visceral class, and I told about, I won't tell you the story, but I just told the story about, you're supposed to chew 100 times each mouthful, and there was 100 chew room. I lasted about 3 chews, three bites in the 100 chew room. Not a good record in the 100 chew room. Okay, all right, so I'm actually gonna put these on this table over here, and we'll be around for a few more minutes. And look, we have a YouTube channel and a Facebook, and I'm trying to learn to do Instagram, and so we got all that going on, okay? All right, thank you everybody so much for coming. Thank you.